This is WPSL Port St. Lucie, the talk of the Treasure Coast.
It's 10:08 at WPSL 1590, the talk of the Treasure Coast. And you're on Bone Talk with Dr. Ed Southward from his palatial pet house in Martin County, overlooking the Willoughby Golf Club. Good morning, Doc. How are you?
Morning, Greg. How are you?
Doing okay.
We have the honor of Dr. Wierzbicki being down here in Stewart as well. He'll be with us just momentarily.
Very good. Very good. If you want to scoot over to your left.
Well, I just wanted me to save room for him. He's probably going to want sitting there.
Oh, okay.
We don't have our camera is a little bit technologically limited to catch both of us. So that's where he's going to sit. So
that's all right.
As long as you can hear us.
So both of you will be sharing the presidential suite, huh?
Yes, we will. So it's
very cool.
It's the first Thursday of the month, and we are usually both down here together. But that's it. But if you
okay, I gotta ask you, it's not orthopedic related.
Okay.
The whole Tua concussion situation.
You know, that's a very interesting question. Concussions are a big deal. It's something that Dr. Wierzbicki probably really has a passion for because his sports medicine training. They're a lot more first line on the sideline than we are. Tua's got a tough situation ahead of him. There are people suggesting he retire from football altogether. There's something to be said about that. There's kind of a catch-22, right? I mean, here's a man that's worked his tail off. I mean, I don't think anybody can really argue against his work ethic, athletic talent, unmatched by many other people. I mean, he's at the top 0.1% of athletes in the world in the sport that he chooses. He just might not be physically built to play the role of that sport in that level. It's just, I forget, Jason Whitlock actually did you see Whitlock's talk on him not that long ago?
No, I haven't seen Jason in a while. So
no, Whitlock has his show though.
Yeah, I know.
There's snippets of it and whatnot. And, he touched into it that, the guy's great. The guy's talented. The guy's exceptional. I mean, he could change the face of the Miami Dolphins, but not from the sideline, and certainly not from a wheelchair.
Yeah. Well, the foremost expert on CTE, and he's from up your way. I can't think of the doctor's name now. I was reading about him in the New York Times, but he just said that Tua has reached a point of no return if he comes back.
Correct.
And that's real scary. And he apparently has analyzed several of the NFL players who have died of CTE or related stuff. That's mortifying. I mean, that is really mortifying to hear that.
It brings to point a whole argument and conversation of athletes in general. In particular, for me, this was a new experience for me. We joke about my lacrosse love and whatnot, but when we moved to Northeast Florida, when I was working in Ponte Vedra area, I had not been exposed to high school football, and this was during COVID, obviously, so it wasn't anywhere near what it was 5 years ago, and nowhere near what it's going to be like probably in another 5 years once we finally ever decide to get past this COVID. the insistence of players getting back on the field, the drive, the misunderstanding of what it means to be a high school athlete or a college athlete, or even for this matter, a professional athlete. We talk about how professional athletes are dealt with differently, at least from an orthopedic standpoint.
Sure.
The studies they get, the MRIs they get, the treatments they get, treating them as a commodity so they can get back on the field. And I'm not saying that happened in this situation. Sounds like they follow the protocol through and through. He passed, according to what is being released, he passed his battery of tests and he was cleared to play. But when you look at the high school athlete and you bench them, and you look at the college athlete, I had a high school athlete in my office this week, very talented local lacrosse player, multi-sport athlete, and I had to make the decision to alter that person's weekend. It's they're just not ready to be out there, and for both physical ability versus their ability to present themselves in the top level and potentially further avoid injury down the road. And that's not from a head injury. Head injuries, concussions are a big deal. And it's, I don't know if we're taking it seriously enough. I don't know if we're benching and sitting players for as long as we should. There's talk about extending the season, decreasing the preseason, and giving marquee players rest. Instead of having 16 games, have 18 games and only play 16. So that means Tom Brady would only play 16 games out of the career, but spread out of the season, but spread out over another 3 or 4 weeks. Basically give every player 3 bye weeks or more. Which, there's something to be said about that. And it's just really hard to understand. And yeah, the NFL is overreaction when they pulled 10 or 14 people from play as a result of what happened. I think that's more of a knee-jerk reaction, but it's something that needs to be looked at. The neurologists need to really get involved, and it's just need to re-examine the sport altogether. So, but it is unfortunate. It is unfortunate.
Yeah, well, you look at the numbers of head trauma and various versions of it throughout the league, and you see that. Have you seen that new bubble helmet that I forget what they're calling it now, the shell or something like that?
Yeah, it's like a helmet within a helmet, so to speak.
Yeah.
Yeah.
And I know that the quarterbacks who were polled in that said it is very heavy and very uncomfortable. But I don't know, it's like, and you see the way, because the guys are getting bigger,
right?
They're faster, and quarterback really is a vulnerable spot.
Right.
I mean, how many hits can you take from a quick 350-pound guy?
Right. And we talked about this, I think, last show or the show before that. Exactly to your point. It's our level, what we're learning about the human body and how we're achieving levels of peak performance, whether that's naturally or done supplemented, so to speak. To your point, I mean, nobody ran a 4.240 that was 250, 280 pounds 15, 20 years ago. I mean, that's force is mass times velocity. Isaac Newton, it's not going to change no matter how you slice it. And if you have more mass and have more velocity, when you hit somebody, you hit them. And you can do all the things in the world you want to change to protect the quarterback, try to make them, the 3-step rule or whatever the case may be, but that also changes the game. I mean, it's how do you get a guy that's running full tilt? If you have a linebacker that's able to break through an offensive line of just straight up tree trunk monsters, that person's moving with force. How do you get that guy to slow down, to not hit the quarterback without hurting himself, without hurting a lineman, to try to deviate from him, maybe deviate and hit his own defensive lineman? It's a very challenging situation in a very difficult sport with really high level top tier athletes. But to go back to your point, it's when you see things like that, you really have to take real look at yourself and say, maybe it's time for me to step away from the game. this is an eye opener for him. He has an opportunity to, live his life, do something. He's made his money, he's going to get paid. I know it's more about the sport than the money, but here's a situation where you might want to just say, collect your check and go, and maybe help other people, right? I mean, the whole league saw that. I mean, you looked at people. I mean, I think, what was this? No one had ever seen that in the history of professional sports, that type of TBI injury. And it spread viral like instantaneously. They didn't even replay it. You remember on Monday Night Football when Nate McCallum kicked himself in the mouth?
Yes.
And they show that replay over and over and over and over again. They didn't replay that Tua thing. They saw that, and that was the end of it. It just stopped showing it. You know what I mean?
Yeah, there's one thing with a hit, and I remember Jim Plunkett telling me, and this was in an era when, I remember really turning the clock back probably before you were born. In the 70s, we had a guy with the Chargers, Doug Wilkerson, who I think was the first 280-pound person in the NFL. I mean, you think about that and go back to the, 70s, maybe early 80s, and you never even comprehended a 300-pound guy, let alone a 350 or 370 guy,
right?
Who can still run like a gazelle,
right? Yeah,
no,
it just doesn't happen. I mean, it's amazing. I mean, people don't realize it. You sometimes you stand next to some of these guys and you just, I'm not a small person. I'm north of 6 feet. Dr. Wierzbicki is, well north of 6 feet. But 6 feet, but up and 6 feet wide are two different things. I mean, and these guys are real monsters. It just, not that I want to segue into another topic, but it ends the debate over whether or not men are biologically more advantageously designed for sports and physical activity than, say, women. The whole, women and, trans and sports and so forth. I mean, you stand next to an NFL defensive lineman, there's no argument.
It. No, you definitely know it.
I mean, look at all the college guys. You remember when Ian Schrager opened the Delano down in Miami? And it's, where do the ex-NFL guys go to work? They go work and they're bouncers. So, I mean, the guys, you knew the bouncer in the Delano was there because when he stepped in front of the light, the whole room got dark.
Yes,
so,
that's true.
It's just crazy that we're talking about the Tua thing.
I was going to say, are you guys talking about the Tua injury?
Oh, yeah. Well, it is the expert, the CTE expert in New York, who's analyzed all the players who passed, says that one more hit and Tua is at the point of no return, which is really mortifying to hear something like that.
Well, I don't know. And that to me sounds like he's reaching, and that sounds like a clickbait headline, hey, listen to me type thing. I mean, who knows whether or not he had an initial concussion, in that game against the Bills when he went down. The neurologist evaluated him. They had another neurologist evaluate him during the week. The team doctor evaluated him. They would not have put him in that Thursday night if there was any kind of concern. There's no way. And so unless you say that our medical tests are just not good enough at diagnosing a concussion, which is a possibility, but I think that there's a 0% chance that that we had any kind of clinical evidence that he had a concussion the first time. Maybe he did, and we're just not able to diagnose it yet. But yeah, if he had a concussion at first and then had a second concussion, yes, then that doctor's statement could be correct. I was talking with Dr. Williams, our spine specialist, and he was watching that game, and he said, no, he didn't see any signs of a concussion. He was most worried about the back injury, and that's what has been well documented. He watched Tua get up, and he says, no, I see a back injury right there with the way that he came down and how his leg wobbled. So who knows what to believe, but I think that head neurosurgeon who was fired, well, someone had to take the fall. The NFL had to do something, and so they just decided he's going to be the fall guy. So that's the way I see it, but I have no idea. That's my best guess.
Yeah, I think we're entering the whole era. And, as Dr. Ed and I were talking about that new helmet, the helmet within a helmet. I don't know if that's the answer. I know it's a lot heavier than the existing Bell helmet that they use.
And Greg, we were talking about that, but before the NFL season, how they were
Yes.
going to have these, the helmets that were position specific helmets. Do you know, are they using them this year? I didn't notice, or is that coming out next year?
They're talking about starting now.
Okay, but they're not currently using the position specific helmets in football.
They used them during the training camps to get data. And, I think now the Tua thing has changed everything. I mean, it really has. I mean, there are a lot of eyes on the NFL, and we're talking a lot of eyes, probably some legal eyes, looking at that whole situation. I mean, what happens if he does go down again? I mean, and
football's a dangerous sport. It's a possibility. I mean, it's a risk that he's taking by electing to be a football player.
Well, and that's interesting. You say Dr. Williams looked at it, and of course his specialty is spine, and he immediately said that's the back.
And this was before, he said this before Tua went down on that Thursday night injury, with his with the flexion contracture in his hand. He said that before that second injury. So he called this, I think he called it right initially, right at the beginning.
Wow, it's crazy. It is just crazy. But it's going to be interesting. But you see, what is going to trickle down now? You guys will deal with Treasure Coast athletes. Will it? I mean, are you going to need a time when you're going to need a neurologist on the sideline of a Martin County football game or something?
I don't know. Because and there's other political things that are going on that limit us right now with the Martin County athletes. And the big one is that our medical insurance that covers us for being a doctor does not cover us for being an on-the-field athlete in this area. Because of everything that's going on with the Jessica Clinton stuff and some other athletes in the area, they won't cover us, or they make our coverage so exponentially large to maintain that medical malpractice that it's just not feasible for us to be on the sidelines. And so I think a big thing that would have to happen in this area is there'd have to be some kind of a Good Samaritan type clause put into our license to allow us to do that. So unfortunately, I think that's what it's going to take. I know one of our doctors before, he wanted to do some MMA ringside coverage, and it was very difficult for us to get him medical malpractice insurance to be able to sit there on the sidelines and evaluate those fighters. So unfortunately, that's kind of our system, and I think that's what it's going to lead to. And now, if someone wants to come into the office and have us check them out, that's totally fine. But there's just something unique to the on-field coverage, which is sad. It's unfortunate.
Yeah, because I mean, I remember the day. Of course, this is 20 some odd years ago, when there was always, like at Port St. Lucie High School, there was always a doc from St. Lucie Medical Center there on both sidelines, and now it's like you just don't see that anymore. But like you say, it's more medical or insurance company or legal related than medical related.
And what direction, what trickle down might this take? It may unfortunately put more of the responsibility on the head coaches. I mean, look at college sports. We've seen it now for multiple years in a row. The coach is supposed to have control of everything. If you ask the NCAA and the politicians and the lawyers, the head coach is responsible for everything. And so, unfortunately, that may trickle down, and they may say that the head coach is responsible for everything here. And the head coach, they may not want that responsibility, and they may push for athletic trainers or doctors on the sidelines. That would be my next guess of what direction it's going to go.
Yeah, I don't know what the rule is. I know in Palm Beach, the expectation is there's trainers. There was in St. Johns County. I'm assuming in Martin, you have to have at least an athletic trainer.
No.
You don't,
No,
even for football.
Not on
Yeah.
the Treasure Coast. No.
See, in Palm Beach, you do. And as well as in St. Johns County. And in fact, in St. Johns, we used to have physicians on the sideline.
oh yeah, University of Florida, everywhere in the Gainesville, Alachua County area, Tampa, St. Pete, all of them, it was required.
Yeah.
Yep, an athletic trainer and a physician for games.
Well,
So-
and with IRSC, I mean, we have a full-time trainer, and she covers the whole spectrum of sports, from swimming, to baseball, softball, basketball, you name it. She's doing it. And then there is a doctor on call if we need that as well. But yeah, I mean, so far we've been lucky enough at IRSC, just the trainer can usually handle whatever happens, unless you get a major injury, and then of course they're ambulanced out to a hospital.
I mean, unfortunately, this is a very political thing, and there's some wrong things that are currently in place politically when it comes to athletes and their medical care and management. I mean, right now, I mean, all high school athletes do have to have a medical clearance to participate in sports in the state of Florida. But unfortunately, as a weird example here, a chiropractor is okay to listen to your heart and do your general medicine exam and clear you for high school sports. This could be someone who has previously had heat strokes and an abnormal cardiac history, abnormal family cardiac history, and you're having an untrained chiropractor listen to their heart to decide whether or not they can participate in sports. That's odd to me. So I would really like to see that law changed. And of course, I'd love to see a law change where you need athletic trainers on the sidelines of all contact sports, and a physician at least on call.
It sounds good to me. It makes a lot of sense. It does make a lot of sense.
I don't know why it's that way, but
Yeah, I'm surprised.
it doesn't make any sense.
It's money.
There must
It's
be money then. Yeah, money.
It all comes down to money. That's wow.
Well, I mean, it's that, and you also need to get the staff too. I mean, it was last year, I think, when we first moved to town, it wasn't until the 11th hour that, even though it was required in the county, that our high school didn't even have an athletic trainer on staff, and then they got one almost after the season had already started. Like you said, and it's whether it's money's not available or people don't want to take the money that's offered to them. It's really challenging. I mean, Dr. Powers started the sports medicine program in St. Lucie County when he first got here, if I'm not mistaken. And to your point, money got in the way. It was just, there wasn't enough support. I guess the money dried up, and then it was, who's going to cover this? Who's going to pay for this? You can't do it for free. Even if you're doing it, just to donating your time situation, there's still an expense of taping and equipment and, sideline tables and, all these other things. I mean, yeah, okay, here's my time I want to do for the community, but you still need equipment to care for the athletes.
Sure.
You can't donate that too. So,
yeah.
I don't know, because you think about the things that are going to grab the headlines and will unfortunately make people change. And those big things that they will grab the headlines are the heat strokes and in Florida, and it's going to be the concussions and spine injuries. Greg, in the state of Florida, at a high school football game, do they have to have EMS on site or within a certain distance? Do you know?
They used to, and a lot of I remember back. Oh, and this goes back to when we first got here in '93. The first play of the first football game that we did was a kicking situation, and it was a Port St. Lucie high school player, and he was severely injured. Luckily, I mean, it was one of those I guess volunteer ambulances that was on the sideline, but they at least could get him to St. Lucie Medical Center, which was 5 minutes from the campus, and they had to do that. But I mean, yeah, that but I'm not sure. I haven't looked around to see if there were ambulances at Martin County High School for the last few games we've done, but there probably are.
I was going to
somewhere.
guess yes, but I'm not confident on that.
And I'm not, to your point, it might be feasible in Martin County, but then if you look at larger districts like St. John's, like Palm Beach, I mean, I forget the astronomical number of high schools that are in Palm Beach County.
Oh yeah, it's huge.
If you went and cut that in half, right, because they're all playing somebody else, are there enough ambulances to actually be at 20-something games on a given night if they're all playing on the same night? I don't know. I mean, it's because most of the ambulance corps are volunteer fire departments now, or I think Palm Beach might be paid fire department, if I'm not mistaken. But the point is, I mean, where are the resources coming from? Am I going to pull 20 ambulances out of my ambulance corps in my county and take them away from other? I don't know. Or do you have to hire a private ambulance corps? Do you hire, some of they might not be paramedics, they might just be EMPs. They do the day transport. A lot of the ones, they do transportation services and then hire that corps at night because they're not really running at night to cover the games. I mean, who knows? But again, here we go. Money. Who's going to pay for that?
And I'll tell you, there's a lot of money in concussion diagnosis and concussion management. And there has been since before Tebow's concussions. That's really when I remember things getting really crazy with the concussion. So that was early 2000s, let's say 2005. And that's when I went up to kind of the hub for concussion research at University of Pittsburgh and saw the stuff that they're doing. But even their stuff, I mean, where the real money is going to be is, can someone develop a blood test that says you got a concussion? I mean, and when someone gets a good blood test like that, a sideline finger stick, is this chemical present in your blood? Then, they're gonna make a lot of money, and that's gonna save a lot of this headache right there. Because the computer tests are inaccurate. These mini mental status tests, that follow my finger with your eye stuff, those are inaccurate. We need a definitive diagnosis.
Okay, so how would a blood test do that? I mean,
certain enzymes. The thought is that when the brain has that kind of injury, that certain enzymes will be secreted into the blood. And if we can find those enzymes, then we can diagnose that concussion. There's been a few that have come close. It was a few years ago, I saw one with traumatic brain injuries. There is a certain type of chemical that's released in the blood, an enzyme, but I don't think it had to be a certain level of traumatic brain injury and concussions. It wasn't a good enough test for concussions, but they're looking for similar things like that. Yeah.
Wow.
Because MRIs aren't doing the trick, CTs, there's no other tests. So that's why when you go and see the doctor for a concussion, they're doing the mini mental statics exam, say, hey, remember these 5 words, count down from 100, what's your name, what's the date of birth, all of that stuff, but it's not good enough.
Well, the other problem is a lot of the tests that we have at our disposal, most of us don't use it very often, so we're revisiting it. And then the other one is if they're compared to a baseline, which a lot of times, if you don't have the staffing to do the baseline, it's not there to begin with. So what do you compare it to? I mean, you're doing your baseline test at the time of injury. Okay, so what's the knee-jerk reaction to that? Which, whether it's the appropriate or inappropriate reaction, you sit that person. Okay, you might have a concussion, you might not have a concussion, but I watched that play. I saw how hard your head hit the ground. Your mental status test, your neural battery test on the sideline is, in my opinion, altered, but I'm comparing it to nothing because we're at time 0 right there. What do you do with that information?
You make a good point about the sensors in the helmet too. That's where some of the money went for a while. And there was interesting data, but what they ended up finding is that the offensive linemen on every single play, they were having forces in their helmet that were equivalent to, to getting hit in the head, by a boxer, or what you would experience being in a car crash. So the forces are just through the roof. And so you can't say this force or that correlates with an increased risk of a concussion. There's something else to it.
Yeah, I remember some of the offensive linemen that I dealt with that said that it was like hitting a concrete wall every play. I mean, that's awful. It's terrible.
There's the movies have done funny scenes with the kids getting knocked out, and hey, what's 3 minus 2, or how many fingers am I holding up? And they would joke, hey, he never knew that in the first place. Ask him this question instead. And so, yeah, they have some fun with that, but that kind of piggybacks on what you're saying. You need a baseline for each of these studies, for each of these people.
I mean, not everybody's a Rhodes Scholar, not everybody, you know what I mean? So it's that actually, to the point of, even though we do it in a humor fashion, that may be the person's baseline.
Yeah.
So again, the comparative test. So you're supposed to do a battery of tests before the season starts, before play initiates. You have to go to someone who's qualified to do it. Doesn't necessarily have to be a neurologist, but even your athletic trainer, if they're trained on how to do these tests, and if you don't have the staff, you don't have the ability to do them, then those tests are pointless. They're only there for comparative analysis, and your data point is just non-existent.
Yeah.
And most likely, if you do not, say, attend, let alone high school, putting high school out of this, but if you don't attend like a very large Division I university, the university will not have a medical staff large enough that can get you a baseline.
I mean, it's hard to say. I mean, when I was up in St. John's, we did a lot of work with Flagler. I mean, you said IRC. I would venture to guess, I mean, this is just me throwing this out there, I would think most programs, because I'm pretty sure the NCAA, regardless of whether you're Division I, II, or III, they're probably pretty stringent on expectations. You have to have at least somebody on staff to oversee the athletes. Now, club sports and what have you, probably less so. There's no comparison to University of Miami or Florida State or Florida medical staffs for football as opposed to IRSCs, basketball athleticism coverage or medical coverage. But I'm sure there's something. I mean, the NCAA is not playing around because they're all about money too. If they screw up, someone's going to come after their money, and they don't like to give up their money. So.
And it's really excessive in D1 college sports. How many doctors are there working on the sidelines? I mean, when I was with University of South Florida, easily there were 6 doctors on the sidelines. I wouldn't be surprised if the average number of doctors on the sideline was 8. I mean, there are so many doctors there on site, and it's sad that all the resources go into that, but then you have 0 sitting on the sidelines for a high school football game. But yeah, that's our world right now.
Well, and okay, you mentioned that, and you probably had more doctors at South Florida than you did for the Tampa Bay Bucks. No, seriously.
Well, but the pro sports, they're really concerned about things getting out, and so they would actually have less doctors on the sidelines because they wanted less. They didn't want leaked information. So I think it's going to be typical of most of the NFL teams. They weren't as concerned about that at South Florida or with the Gators. Yeah.
Wow. Oh, I guess we're 40 minutes into the show. I think this is an orthopedic show, isn't it? Oh, it's.
It's a funny thing because to your point before when you brought it up, this is something that they bring up in our training. It's especially if you do a fellowship in sports medicine. Concussion management and recognition and so forth. And again, it ties back to the point that not everybody on the sideline is qualified to do these tests. I can tell you right now, personally, I don't feel comfortable doing it. Yeah, I did my concussion training as a resident. I answered the 3 or 4 questions that were on my board exam, and I got them right because I memorized the answer. I'm not a qualified concussion physician. I mean, it's just not what I do. I mean, you have probably a lot more training than I do.
It's been 10 years since I did that. It take me a few minutes to kind of refresh myself on the test because, I mean, there's some very specific ways that you have to do this test and it's a very odd test too for how you count points and subtract points. And it's also time sensitive too in how you give it. So if I'm doing this section of the exam with the athlete, you're supposed to complete that in less than a minute. And so as the examiner, you have to know exactly what you're doing. Otherwise, you're wasting time and you're going to throw off the result. So I'm not comfortable with that. And And unfortunately, it's part that medicine and our world has just become very super specialized, which has its advantages, but there's also some disadvantages.
Yeah, because it's so now who does it? It's now.
Yeah.
I mean, we were talking about enough ambulances to cover high school football games. I assure you, there's not enough neurologists in any county to cover all the football games. So then who's next? The sports medicine physician, the family practice physician, the athletic trainer. Like, where does this fall onto? So it really, so to Dr. Wierzbicki's point, if we can find a quick and easy blood test or serum marker or some other type of completely objective data point that is non-arguable, that would really change outcomes for people quite a bit.
Well, that blood test sounds like that would be amazing. I mean, because if you could read that blood test quickly on the
it should, and I'm guessing they'll eventually, maybe let's say sometime in the next 20 years, they'll, same way that people check their blood sugars, they prick their finger, and you have that glucometer that tells you your reading. My guess will be is that someday in the next 20 years, we'll have something like that. Whoever says, go and get your finger pricked real quick, and it'll give you a reading, and then there you go. And then you're good or you're bad.
Or even like that little thingy that they put on for your oxygen level.
Yeah, the pulse ox.
Something like that.
Sure.
Yeah, that would be amazing. That's wow. This is really amazing. It really is. And it's, the thing is, it is affecting everything. I mean, the main topic of discussion in our high school football game the other night wasn't the game as much as it was the whole Tua situation.
Mm-hmm.
Yeah.
And yeah, my guess is he'll be out next week, and then he'll be back that following week, and we won't hear about it again
Until his next injury.
Yeah, Tua's injured all the time. Yeah.
Well, that's how this conversation started, because one of the things that Whitlock brought up on his show not so long ago was that the physical abilities, not ignoring the trauma that he underwent, but the physical abilities of certain people to participate in certain sports. I mean, you look at the pro boxers. How many times are they getting popped in the head? And I forgot the example that he brought up. You'll probably remember this, Greg. But there was a boxing match, probably 20, 30 years ago, where the guy went down on his knee, got up and won the fight. You could tell his bell was rung, and I forgot. I wish I remembered the name. I also have to probably Google Whitlock's show, and just got up and walked it off. It's just. Certain people are built to sustain that kind of repetitive trauma, and certain people aren't. And like you said, his heart's in the right place. He's more athletic in his finger than my entire body. Just might not be cut out for the NFL.
I remember
it's how some of us are just genetically gifted. I was talking with this police officer in Gainesville once, and he was saying that one time he pulled over a Florida gymnast because there was just something odd about her driving. And so he has her get out of the car and complete all the tests, point the finger to the nose and walk the line and, spin around. And she completed everything perfectly, not a single error. But then he has her do the breathalyzer, and he said that it was like a 0.3 or something like that. She was just off the charts, just intoxicated, but she's a Florida gymnast. She crushed all the physical exam things.
Yeah. Oh boy. Yeah. Well, I remember, that's funny you mentioned that. That was either a Sugar Ray Leonard fight that I was covering, or a Hagler Hearns fight. I do remember something like that. It was in Vegas. But I can't remember which one it was, but there was something like that. And he looked like he should have been out for the standing count. Yet he did win. Boy, I can't.
It might have been Hearns. I think that Hearns sounds familiar.
Yeah, Tommy Hearns. Yeah.
Like he went down on one knee and got back up and should have fallen over and and won the fight.
Yeah, that was one of the Hagler Hearns fights. Yeah. Oh boy, I can't tell you which one, but yeah. Yeah, but there again, I mean, you talk about boxers in their retired life going through a lot of stuff. Well, because of all the head trauma. I mean,
Yeah.
Yep.
that was natural. So what's going on orthopedically, guys?
So right now, like clockwork, every single time there's a hurricane scare, there's a big storm coming through, but we see a lot of people injuring themselves. What I tend to hear a lot of is that, during the hurricane prep, putting up the shutters, going around the house and, checking on the status of the house and the floods, that people are overdoing it and doing things that they don't normally do and fall and injure themselves. Or they overdo it and develop some kind of a repetitive use injury. So I'm seeing a lot of people throwing out their backs, a lot of ankle sprains, a lot of rotator cuff issues, from people hanging up their shutters. It's people thinking that their body can handle this stuff when really their body hasn't been challenged like that in years. And so, we're busy right now with a lot of, let's call it hurricane related injuries. Yeah.
Oh my. Yeah, I would imagine.
And I've seen a lot of dog related injuries, and as I run around my neighborhood, and I see the people and their dogs trying to hold on to that heavy dog, man, holding a dog back on the leash, I see so many dog related injuries. Dog takes out the knee, dog, takes out the rotator cuff or makes them fall on their neck. It's, one of the more common injuries, I'd say.
I can tell you the last month, more than 50% of the hip fractures that I've had to fix in both hospitals, dog tripped over the dog.
Oh no.
Yeah. And trust me, I think about it every time, because even my dog sometimes decides, left, I don't want to be on the left anymore, I want to go on the right. It's, okay, but and she's a 90-pound Rottweiler that you're in the way, you're just going to move. So now if you're in, it's just like, but it's amazing. I mean, dogs pulling on the collar, and it's little dogs too. I haven't had a single big dog injury. I've had all these little dogs, little dog in the feet, little dog pulling on the leash, little dog yanking on the fingers. It's funny. I literally just this week, I had a lady that had arthritis of her thumb, had no real recollection that she had arthritis, no thumb pain at all until the leash wrapped around her thumb and yanked on it. Now she's got excruciating arthritis pain.
Didn't you see some unique bites recently, like a cat bite or a duck bite or a bird? Oh, you've had some bird bites.
Parrot attack. Yeah, this guy got attacked by a parrot. Just pecked this. It was very weird. The guy, somehow pecked at him. It has almost a little calcific deposit, almost like a callus actually, just in the web space of his thumb. Because the bird just peck. But it brings you some weird stuff. Yeah.
Okay, explain that one to your insurance company, huh?
Right. Well, it's funny because you don't even realize. I mean, cat bites, for example. I mean, it's on our board. It's on our training. They're actually a pretty severe injury. If you look at what most people would think is a minor thing of a cat bite, cats have very long fangs. They're very sharp. When they bite you, they go very deep. And if a cat bite, an acute cat bite, needs to go to the operating room. There's really no ifs, ands, or buts about it.
Wait a minute. What?
100%. Look it up. Check your resource, Dr. Google. Cat bites have a very, very high prevalence of going into the tendon sheath. You can get a fulminant flexor tenosynovitis because of it, and it's something that we don't think of. You're petting your cat. I'm not talking about the little gnawing when the cat's just. I'm talking about a bite. When the cat draws blood, you need to go to the OR.
We should actually quiz Greg here. So Greg, a bite by this species or whatever has the most bacteria. So if you get bit by this, it's more likely to get infected. Any ideas? I hope I'm still right on this.
I'd say like a squirrel or coyote or something like that.
It's a human, isn't it?
Yeah,
it's a human.
What?
Yep. We have one of the dirtiest mouths out there.
Mm-hmm.
So.
Yep. Isn't that crazy? I
Whoa.
wonder why that is. I got to ask my wife that sometime. Maybe a combination of my wife, the dentist, and a vet. Maybe they can put that together.
Right.
Why exactly a human bite has the most bacteria?
It's just strange.
Yeah.
But for example, from a bacterial penetration standpoint, you're much better off getting a dog bite than a cat bite. Cat bites quite often, especially in the hands and the fingers. That's an operative injury. A dog bite, you could usually just wash it out in the emergency room, even at your home if you have the right sterile equipment. Now, I'm not talking about a dog bite that's not dog attack. I'm talking about a dog bite. Dog bites, bites the mailman in the butt kind of thing, a little tetanus shot and it's over. Cat bites you in the hand, that's a surgery. So it's a totally different ball game. And you see this all the time because there's a ton of pets, especially exotic pets in Florida. People get bit by all kinds of, last time I checked, the iguana bites can be deadly. Those are surgical emergencies. It's just, and you just don't think about it. You have a pet and they bite you and you move along your way and so on and so forth. But that's some orthopedics for you because that's when you do it.
This is amazing. I've never even thought about pet injuries.
Not even pets. Just think about
major orthopedic problems.
It's not even just pets. Go walk in, Lockahachie Preserve or go. What's lurking behind the bushes there? The species of snakes, the species of spiders. It's just there's a lot of things in Florida that you can't see that can kill you. It's not the bears, and it's there are a lot of things out there beyond gators that
not the sharks. The sharks, sharks will bite you. They'll give you a little kiss.
Right.
Yeah.
You'd be
surprised.
other
things more deadly.
Yep.
Yeah.
Wow.
Good info, huh, Greg?
I think I'm gonna crawl under my bed. Although there might be a spider under there, so
Yep. Yeah.
Oh man. So that's interesting though, that around the hurricane, you've seen hurricane-related injuries.
Oh yeah, and I was telling Dr. Southward and Dr. Williams, we'll see it that way for months. People will be sitting on their pain, trying to make it go away on its own. And 2 months from now, I'll hear still a lot of people coming into the office every single day saying, "Oh yeah, it originally started when I overdid it for that hurricane prep, where I fell in my backyard." And so, yeah, from the days afterwards to months afterwards, we'll see hurricane-related injuries. Yep.
Well, it makes sense when you think about it. You saw the videos of the preparation, right? Filling sandbags. Look at the speed that you try to complete tasks that you don't do on a regular basis. It was the same thing in New York. As soon as the snowfall hits, the ER was full of people hurting themselves from shoveling snow and snow injuries and so forth. It's, and then we're getting towards the end of the show, but it goes full circle to something that we talk about all the time is physical readiness, staying mobile as we get older, so on and so forth. If you take, it's not the people that are in the gym 24/7, 365, or have a stable, have a good exercise program or so on and so forth that are getting hurt. It's the others that are not taking the time to do those things. Yeah, okay, the physical athlete, might trip and fall because the wind blows while he's holding a piece of plywood and tears his bicep tendon. I had a patient like that not that long ago, not hurricane related, but same thing. You're just not prepared for this. So now all of a sudden, within a 12-hour period, you're boarding windows, you're filling sandbags, you're moving things. It's just the demand you put on your body, pop, 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 pop. It's no surprise that you get overuse injuries in a 12 to 24-hour period.
So I actually read a stat recently of something that kind of applies to this, that I'm glad I finally read this stat. So when we talk about just the activity and exercise requirements that our national medicine and orthopedic organizations want us doing, if you look at all the adults in the United States, 25% of the adults are meeting those requirements. Another 25% of those of adults in the United States do literally nothing. They do not exercise in the slightest. They go from chair to chair. They do literally nothing. 25% of the adults in the United States. The other 50% is somewhere in between. But I couldn't believe that.
No.
Yeah.
Yeah, I've been accused.
I was surprised on both fronts that there's 25% of people who are meeting that. I would have guessed it's far lower, like 5%. Yeah.
What did I do with the number was? Was it like 3 hours a week or?
They boiled it down to a couple different categories.
I'm gonna look it up.
Yeah,
I'm sure it's more than you think, but less than you would expect, if that makes sense.
Mm.
Yeah, it's
Well, and even some stuff like you talk about hurricane related, cleaning up like the brush and several branches fell from the trees in the backyard. Well, we've been dragging those out. And I know our backs were a little sore for a day or so. And you think, wow, well, okay, we're just not used to all that motion being that way. Yeah, I get it. I get it. Wow.
So, yeah, I mean, that's what people should be doing, is they should be doing a little bit more regular physical training to prepare themselves for these times that they need it. And then those times when you do need it, you got to pace yourself. And yeah, there's a lot going on when the hurricane is coming down the pipe, but I mean, you got to call on help. You got to space things out, and that's it. That's all you can do. And just go slow and steady. A lot of us think too quick, we move too fast, and we get ourselves into trouble that way.
Yeah. Yeah. Wow. It's amazing. Well, you've got 2 locations, obviously. You're on the 19th hole down there in Martin County. But where do we find you, doctors?
Yep. Our telephone number for Florida Orthopedic Specialists is 335-4770, 335-4770. And you can find us at our Stewart office off of Highway 1 and Indian Street, or in Port St. Lucie off of Highway 1 and Veterans Memorial.
Yeah, that's highway.
Yeah, Veterans Memorial Highway, or Walton Road, right across from the Civic Center. All right. Well, thanks, Greg. Good show.
Yeah, and the one phone number is for both locations, right?
Got it. Yep.
All right. Well, Dr. Ed, Dr. Joe, thank you so much. And you both be safe, and we'll talk to you next week.
All right, guys.
See ya.
Thanks, Drake.
You've been listening to Bone Talk right here on WPSL, Port St. Lucie. Talking the Treasure Coast, webcaster to the world.